Hello, thank you for tuning into the Natural Health Rising podcast. My name is Rachel Smith. I am a certified functional diagnostic nutrition practitioner, and I've helped hundreds of people naturally reverse symptoms of autoimmune diseases and other health challenges, from digestive issues to hormone imbalances. And in these weekly episodes, you're going to learn from myself and top health experts from around the world about functional medicine and holistic health tips to help you rise to your healthiest, happiest self. On this episode of the Natural Health Rising podcast, I have Dr. Gary Kaplan with me. Dr. Kaplan is a DO, clinical associate professor at Georgetown University School of Medicine, founder and medical director of the Kaplan Center for Integrative Medicine, and author of Why You Are Still Sick: How Infections Can Break the Immune System and How You Can Recover. A pioneer and leader in the field of integrative medicine, Dr. Kaplan is one of only 19 physicians in the country to be board certified in both family medicine and pain medicine. Welcome to the show, Dr. Kaplan.
Rachel, I'm delighted to be here. Thank you for that effusive introduction.
I would love to hear more of your story. Like, what made you go down the path of becoming a DO? Then you opened up this Center for Integrative Medicine, and you really focus on caring for those with chronic illness.
Yeah, so the DO story, I always thought the conventional medical establishment is not particularly good at managing chronic illness and chronic pain. And I thought the osteopathic profession was actually better poised to do the full range of conventional medicine, but also understood the necessity of dealing with the musculoskeletal system, which is 70% of our body mass, where the MDs had somewhat neglected that. So I've kind of straddled those fields, but early on I was very interested in integrative medicine. I actually very interested originally in becoming a neurologist. And got on my first neurology rotation, got really depressed because it wasn't a blessed thing I could do for most of these people except diagnose them. And then started a journey where I ended up mentoring with Norm Shealy, who is the individual who created the TENS unit, transcutaneous electrical nerve stimulation, the dorsal column stem. So Norm was really a neurosurgeon pioneer in the field of pain, but he also was a pioneer in the field of integrative medicine, holistic medicine. So I worked with Norm for a number of years. I got a chance to serve on the board of the American Holistic Medical Association, and then got involved with acupuncture with Joe Helms, and served on the board of the American Academy of Medical Acupuncture, and then served on the Research Foundation and was part of the crew that helped bring that to NIH and through the consensus process. So long journey.
Mm-hmm. That's amazing. So now at this point, as you're working with these people who have chronic illnesses, I know you deal with long COVID, as it's called. So I read somewhere that I think it's 1 in 5 Americans who had COVID continue to suffer with this long COVID.
Yeah, people who've had it, about 20% of people who've had it continue to have symptoms: fatigue, focus, concentration issues. Fatigue far and away the most, but somewhat chronic pain, loss of smell, loss of taste. It's a pretty nasty bug. Some have heart disease continuing on from it. Others have paresthesias, unusual sensations in their hands, legs, or lack of sensation. So it's a bug that can create problems in virtually the entire system, anywhere from heart and digestive system, irritable bowel syndrome, nervous system. And it's a bug which tends to hang out, unfortunately, for extended periods of time, or at least does damage, so that symptoms continue for extended periods of time.
Mm-hmm. Ooh, where's the bug hanging out specifically? Does it?
Well, so that's an excellent question. The question is, does the bug hang out? So I use that more probably metaphorically than actually. The bug seems to come in, do its damage, and leave. There's some debate as to whether or not there is persistence of the bug in the system, but realistically it looks like the bugs come in, it's done damage to the immune system, leaves, and it's the persistent damage to the immune system that really is the ongoing problem. And indeed, this is not unique to COVID. We see it in influenza, but we also see it in pandas and kids who have these pediatric acute onset neuropsychiatric syndromes associated with strep, but also we see it in post-treatment Lyme syndrome. We see it in a whole range of infections that come in, damage the immune system, and leave. COVID, the blessing in disguise is that a lot of this stuff has been written off for years, especially the chronic fatigue syndrome group.
Mhm.
And they have been at best regarded as second-class citizens. Unfortunately, you know some of this yourself from your own personal experience and how physicians were treating you and not listening to you, not paying attention, and saying, well, the labs are fine, you must be faking. And the answer is, no, you didn't do the right labs, and so that's why you didn't get the right answer. So
Mhm.
the post-COVID stuff has now thrown in our faces huge number of people, 5% of those who have, or 20% of those who have in fact had COVID. It looks like about 7% of people nationwide are dealing with post-COVID syndrome. And
Mhm.
so we're now all of a sudden like, oh, wait a minute, this post-viral fatigue stuff is real. Post-infection fatigue stuff is real, and what's that about? So now there's literally hundreds of millions of dollars being poured into research that I think is finally going to get us much better answers than we've had previously.
That's good. So you mentioned that there's this essentially like a dysregulation of the immune system that occurs. However, do you find, or is there research showing that there's other root causes that would make someone more susceptible to getting that long COVID versus somebody else who, you know, those other 4 out of 5 who don't get that?
And there, Rachel, lies one of the most important questions, the most neglected questions before us. And you're absolutely correct. The question is, what's the soil? What's the soil in which this grows? And so the reality of the matter is, what's happened with these individuals? Clearly, there's genetic predisposition and percentage of these individuals. We don't know the specifics of those genetics yet, but we know it's there.
Mhm.
Second is environmental factors called epigenetic factors. That is on top of. These are things in our environment that turn on and off the genes. What are those things? Well, you may be familiar with a few. Nutritional factors, heavy metals, mold toxins, blasticides in our environment. So there's, and euphemistically referred to as adverse events of childhood.
Mhm.
But the reality of the matter, this is child abuse. And we know that post-traumatic stress syndrome, all of these things can set you up for seeing damage to your immune system long term. And in the adverse events, PTSD, childhood stuff, we're talking about a 15% increased risk in developing autoimmune disease in your lifetime if you grow up in that kind of environment. We're talking about a 25% increased risk in developing heart disease and diabetes if you grow up in that kind of environment. So, you know, the environmental factors play a huge role in setting us up for potentially seeing the immune system further damaged. And we need to pay attention to that. So then what happens is with these other burdens occurring, and you're lying in kind of a low level muck while you've got this stuff, and you just put up with it. You're not as energetic as you used to, a few more aches and pains than you used to dealing with. Your focus isn't so good, your sleep isn't quite as good, but you put up with it, you deal with it. I'm just getting older. And
Mhm.
then one day an infection comes along. And by the way, those who think they're getting older are 17, 18, and 19-year-olds. So not getting older. And then an infection comes along and the whole thing cascades into a small disaster, or not so small disaster. I mean, many of my patients are fairly crippled. They're bedridden, have been for years. And we're now seeing with the post-COVID stuff, we're seeing people lose their ability to be employed, lose their having to drop out of school. It really has a devastating effect on these individuals. And we need to take it very seriously. We need to come up with much better answers for them.
Mhm. Yeah, I always think of this stuff when people go from where you say they are a little fatigued and having some issues chronically, and then all of a sudden they get the infection and it blows up. It's like, I think of it like a rain barrel, and all of this
Mhm.
rain and gunk and stuff is pouring into the barrel already. You don't really realize it. And then there's some event, whether it's an infection or an accident or something that happens, that is that last few drops of water that really just overflows this blocked up rain barrel, right? And then everything just starts to go crazy in the body. Um, so if there's so many pieces to this issue, What do you do to start addressing this?
So, your analogy is exactly correct. It is a point that where the dam breaks and everything overflows. And so, what's happening here is the first thing you got to do is take a history. Take a history, and typically that takes a while. And my intake histories are about 2 hours because I need to know. The first question I ask people is, when was the last time you were in excellent health? And the first thing almost everybody does is they lie to me. Lovely people, but they say I was in excellent health until I got this infection. Cool, that's fine. So how old were you then? Well, I was 22 at that point. Good. All right. And as I continue taking history, any history of migraines? Oh yeah. Really? How long have you had migraines? I've had migraines since I was 12. Okay, perhaps not excellent health. How's your sleep? I've never been a great sleeper. You know,
Hmm.
how about pain? Yeah, I got aches and pains and stuff, but you expect that as you get older. No, you don't. So you start to get the history and you start to realize that there's a lot of stuff antecedent to the event that finally brought them into the office and caused them so much despair and
Hmm.
disability. So it's important to get a comprehensive history. And then it's also important then, as part of my history, I take a very thorough sleep history. All right. About 5% of Americans suffer with sleep apnea. Uh, the overwhelming majority of those people, 85% of them, are not diagnosed. So, very quick check in terms of, well, how do you sleep? Do you snore? All right. Do you wake up feeling refreshed? Do you ever fall asleep sitting at a stoplight uh, or at a traffic stop during the day? Do you ever have problems falling asleep in meetings or theaters when you're outside with other people? Do you fall asleep if you go to sleep after lunch? Were you able to fall asleep quickly and rapidly? That's called an Epworth, EPWRTH. It's 2 second uh, check. You can look it up online, and that will tell you whether or not if you're scoring 10 or above, you need to think about sleep apnea. The other thing we start asking: did you grow up in a water damage building? Have you been exposed to water damage buildings? So problems where
Hmm.
there's been rainwater that came in or floodwaters that came in. And it's astonishing how many people have, in fact, been exposed to water damage buildings. And a percentage of them will have mold toxicity. And so you want to start looking at those. Obviously, we're looking for things like histories of tick bites that may have occurred, although I will tell you a very large percentage of people who end up with Lyme disease don't know they were bitten by the tick. And because the ticks come, gone, and left them with an infection. And what was your childhood like? So, did you have a lot of infections? Did you have a lot of problems? Were you a sick kid? Did you have a lot of ear infections? Did you have a lot of strep throats? What happened with all those infections? Because one of the other things I want to look for is whether or not there's an inherent weakness in the immune system. So, if we look at the acquired immune system, if you will, this is where you build antibodies. All right, there are subcategories of that, and we cleverly label them immunoglobulin A, immunoglobulin M, E, G, and so we're going through the alphabet, if you will, in terms of these different types of immunoglobulins. But immunoglobulin G is kind of the long-term protector of this stuff, and immunoglobulin M is the first thing that shows up. But the IgG in a percentage of people is deficient, and so we need to check that. You need to ask. Some categories 1, 2, 3, 4 of IgG, is that adequately present or not? Are there overexpressions of IgE, which would indicate potentially mast cell disorder, um, allergies going on in the system? So there's a lot of questions you need to ask, inclusive of how is your digestion, one you're well familiar with, but astonishingly enough gets overlooked so many times and not properly tested for. So the history is very comprehensive. We want to know pretty much everything about you. And on the basis of that information, it helps direct our testing in terms of what we're going to be looking for. Though I will tell you, my testing tends to be extremely extensive because by the time I see people, they're very sick and they've been sick for a very long time. And we need to design a comprehensive treatment plan in order to help them recover.
Hmm. I love that. Yeah. It is crazy. I ask a lot of similar questions with people, and it's pretty crazy how many people have water damaged buildings, or, oh yeah, it does smell a little musty in this one part of my house. Oh, really? And people just totally ignore that, but it's such a huge problem. So it's amazing that you would do such an extensive intake with people. Um, So then what are the results that once you figure out these underlying causes, at least let's finish talking about long COVID. What types of results do people get? How long does it take for them to recover? Or is that totally dependent, obviously, on those other findings that you're looking into?
So it's dependent on a lot of things. I mean, first pass, if I was in excellent health and then you got COVID, and you've continued with post-COVID, there's a panel that we use. We look at cytokines. Cytokines are the chemicals that come out of the immune system that actually do the work in terms of either causing or damping down inflammation. And so we do a cytokine pattern that's devised by Bruce Patterson. Um, and we look at that to see whether or not there's an ongoing, very significant cytokine response going on. And Bruce has also identified ratios of certain of the cytokines. If they're particularly off, they give a post-COVID syndrome. But we've also been able to use these cytokine panels to also look at and identify post-treatment Lyme syndrome, chronic fatigue syndrome. So they seem to have a little bit different fingerprint. We're still working out the details of that. But at any rate, knowing about the cytokine panels and profiles, we can start with addressing that. And there are very specific medications that we may use in order to quiet the immune system down, things such as Moraviroc, which was an HIV drug, which was repurposed for the use of quelling one of the cytokines, chemokines, 5, receptor 5. But we're also looking at some statins that may be useful. Aspirin may be useful. Things that we see with SDL40, which is a cytokine which is excreted by platelets that may be responsible for a hypercoagulable state, where we see these blood clots occurring in the very small blood vessels in some of these people with post-COVID. So we're looking for that so that we can go after it and treat it. And quiet that down. So I've gotten a bit into the weeds here, but there are specific things that we can do in order to treat according to the cytokine panel. There's a percentage of people who we will treat in that manner, and in a matter of 3 months, they're better. They're fixed, they're gone, they're done, which is great. There's another percentage of people who aren't getting better, and those people we have to take a much deeper dive. And inevitably, what we're finding on those people is that there is issues with either mold toxicity or significant bacterial overgrowth in the gut, or significant dysbiosis, or problems with heavy metals. Another thing we should mention is, where are you getting heavy metals from? Well, you're getting heavy metals if you're eating lots of fish, especially shark, tuna, the top feeders, because what's happening is we're getting mercury as a result of burning coal, goes way up in the atmosphere, comes down, and then the small fish eat it, the plankton eat it actually, and then it slowly works its way up the food chain and gets concentrated in the big fish. If you're eating lots of big fish, the odds that you're concentrating mercury is high. Trout also in the freshwater and things. So, and we're also unfortunately starting to see it in salmon as well. So this business of heavy metals can be a very significant issue. The other place we can see heavy metals in the water system, lead. All right, Flint got huge press several years back because they changed over the water supply, changed the pH, and a lot of the lead leached out of the pipes and into the water supply, and people became very, very sick. But the fact of the matter is, there's a huge percentage of our water supply in this country, I don't remember the exact number, but it's something in the order of about 10%, is lead contaminated because of the lead pipes that we use to carry it. And we don't do enough testing of that. We don't do enough treatment and acknowledgement of that as a problem. And we also think of it as a problem in kids because it will interfere with neuronal development. The fact of the matter is, it's a problem in adults as well. In adults, you see onset of new hypertension and fatigue and a number of other problems. And so lead and mercury are the two big environmental problems. There's also stuff that you can see with cadmium, certainly in cigarette smokers. Arsenic comes out of certain woods that have been treated to be weathered. So if you're a carpenter and soaring, those kind of woods, they tend to be a greenish color. They may be laced with arsenic, and it makes nice to protect them against the environment. It's not so good if you're breathing in the sawdust.
Yeah. If somebody has a pretty big or significant toxicity, I'm sure you possibly do some sort of chelation therapy or some sort of major detoxification protocol. But for somebody who, as you mentioned, like we're all being exposed to this stuff on a daily basis, are there any gentle things or simple things that somebody could do to just kind of maintain lower levels on a daily or weekly basis?
Oh, absolutely. So one of the things that can be done is sauna. Sauna, the skin is an organ of elimination, and saunas are a great way in order to sweat out a lot of the toxins from your body. And so, but you want to dose sauna, so you want to make sure that you start low and work your way up so that you don't make yourself sick. So sauna is an excellent way of helping to reduce the toxic load in your system. Using things like activated charcoal, that like clay, can be good in terms of absorbing toxins within the gut in terms of mold toxicity. For heavy metals, chlorella, which can be purchased over the counter, can also be used for binding of some heavy metals. So there's a large number of things that can be done in terms of detoxing yourself. Vitamin C actually is also a good detoxifant. Using high dose vitamin C, defined as about 1,000 milligrams 3 times a day, also helps along with it. Now, I also want to back into another thing, which is more medically oriented. When we're talking about the immune system, okay, we're talking about two pieces of the immune system. We're talking about the innate and the acquired, right? So the innate immune system is the first responders. They're the guys that rush to the area when things go wrong. Tissues get destroyed for whatever reason, burns or trauma, or infections come in, okay? And they respond kind of in a typical manner all the time. They release very specific chemicals in order to address this stuff. So you want to quiet down the innate immune system as part of what you're doing, and using things like low-dose naltrexone. Naltrexone, a medication which used at high doses, is used for treatment narcotic reversal. It can also be used at high dose to help with keeping people abstinent in terms of alcoholism and sometimes in cigarette smoking. But so but that's 50 to 75 milligrams. We're talking about little tiny doses. We're talking about somewhere between 1.25 and 4.5 milligram doses that help reduce the microglia, which is the innate immune system in the central nervous system, help reduce their activity. So utilizing low-dose naltrexone is kind of one of the first things that I'm doing with a large number of my people. And lo and behold, that will frequently restore sleep. Okay, we want to get you sleeping. Sleeping is absolutely crucial. If you're not sleeping, we got to fix that. Okay, you're not sleeping, your immune system's not doing well, you're not doing well. So it's really crucial that we have you sleeping on a regular basis. Also, sleep, let's talk about sleep for a second. Sleep isn't a thing. Sleep is multiple stages, right? So we have slow wave sleep, we have REM sleep, and we have light sleep, which is stage 2. It turns out that slow wave sleep is extremely important. We measure these by EEG recordings. It's extremely important in terms of detoxification of the brain. Okay. And also in terms of resolving pain. We find that people who are in a lot of pain frequently are deficient in stage 3, 4 sleep, slow wave sleep. So we want to make sure that it's not just the amount of sleep you're getting, because we can drug that, right? We can make you get enough sleep, give you enough drugs, but we want to actually make sure we preserve the architecture. So we want to be really conscious about how it is we've treated you and make sure that we're doing so in a way that actually preserves the architecture of the sleep. So using things like low-dose melatonin can be very effective in doing that. Magnesium taurate can be effective in doing that. And it's astonishing how many people are deficient in magnesium. And so there are different types of magnesium also, as you well know, but you have magnesium glycinate, you have magnesium citrate, magnesium taurate. Magnesium taurate will have the least impact on the bowel, but it crosses the blood-brain barrier the most. And so that'll help replenish central nervous system levels of magnesium. So lots of things that we can do in order to quiet things down. If you're having lots of allergic reactions, mast cell activation stuff, you can tell that by if you're getting rashes and hives and straight congestion. That you want to go after in terms of using things like antihistamines, but there's a wide range of medications and stuff that you can do in order to do that.
Yeah, I'm glad you mentioned the part about giving someone a pill to get sleep versus actually going through the stages, because some of those sleeping medications actually don't allow the body to get into certain stages of sleep, correct? Yeah.
Absolutely correct.
Okay.
Absolutely correct. And
Yeah.
so Ambien being one of those that is notorious in the fact that it will help give you amounts of sleep, but it won't give you the stages of sleep that you need. It may actually interfere with those. So we want to be very conscious of that when we're helping people restore. The other thing we want to pay attention to in sleep that people often overlook is a thing called narcolepsy. All right, narcolepsy is actually an autoimmune disease. Narcolepsy is a result of antibodies being made to certain centers in the brain, and the end result of which is you're tired all day long. You're fatigued all day long. You may fall asleep at the drop of a pen. Now, narcolepsy frequently is thought about in terms of cataplexy, where people are laughing or have some strong emotion and they collapse. All right, that's the classic, but it's actually not the majority. So narcolepsy is a problem where we see distortion of the sleep cycles coming into day-to-day living. And so the way you find that out is you have to do a formal sleep study. First, you rule out sleep apnea. And that can be done in a home sleep study. You don't need to go into a lab to do that. We have excellent devices, FDA approved, that will allow you to rule out that. And then you look and see whether or not you're seeing abundance of REM, or you're seeing, and REM should be about 20% of the night. If you're seeing 30-40% REM, that suggests to you that there's a REM disorder. If you're seeing problems with REM occurring extremely early in the sleep cycle, that suggests a problem. So there's lots of ways that we can get this inferentially, and then we need to put you in a sleep lab for multiple sleep latency testing. So, a lot of stuff. I moved into the weeds again.
No, this is great. I don't want to go too far off this path,
Sure.
but have you seen people reverse narcolepsy? If it's an autoimmune disease, can they calm the immune system enough to?
It's a really excellent question. One of the problems we see with a lot of autoimmune diseases is that once the genes get expressed and tripped off, we don't seem to be able to quite turn them off again. And so once you got it, you got it. Let me give you one example. So it doesn't mean we can't control all the symptoms. Okay.
Right.
So that we can absolutely do. But I have a young woman who developed Hashimoto's thyroiditis. She developed acute thyroiditis, and they were actually a young woman in her teens, and they were getting ready to remove her thyroid. And her mother came to me and said, she's had Lyme disease in the past. Is it possible that she has Bartonella? I said, yes, it is, as a matter of fact. And Bartonella has been attributed with causing Hashimoto's thyroiditis. And indeed, we tested her. She was positive for Bartonella, tick-borne disease. We've treated the Bartonella. The Hashimoto's has gone into remission, and they're no longer talking about removing the thyroid. So in this case, it was an infection that set that off. We treated the infection, and she's gone into remission.
Yeah.
Another example of an unusual presentation is a 17-year-old kid I saw who presented with severe depressive disorder, suicidal, was going to hang himself. He actually had tried to, had been institutionalized, treated multiple times for depression unsuccessfully. I saw him, and I'm a neuroinflammatory guy, so I start working him up from a neuroinflammatory perspective. One of the questions we ask is, do you have an autoimmune disease such as celiac? 5% of celiac patients, which is an autoimmune disease to gluten, 5% of celiac patients will present with only neurologic symptoms. They'll be depressed. They'll have problems with focus, concentration, paresthesias. And so, indeed, he had severe celiac. Those people can't be anywhere near gluten, not a grain of it. And so what we did was we took him off gluten completely. Within a year's time, we also did some stuff in rehabbing his gut, because that gets pretty beat up. And in the process of doing that, depression 100% resolved, off all medications. And he's gone on and had a good life. I see him periodically now, once, twice a year for other issues, but he's been in remission and in excellent shape for about 4 or 5 years now. So it's important to find these things because we can reverse them and control them. We may not be able to cure them.
Correct.
But we can get your life back.
Yeah. I think if I was to rephrase the question, possibly getting rid of the symptoms of, right? Because there's definitely, with autoimmune diseases, you will have some of those low levels of antibodies, and the immune system is still a little ticked off and dysregulated, but you can get rid of all of those crazy debilitating symptoms, at least so that you can live a very, very normal life without medications and things like that.
More importantly, if you don't get rid of those symptoms are indicative of underlying inflammation that's doing ongoing damage to you. You want to stop that so that, in fact, you can have a long and good life. Because if you don't do that, that wears at you and it continues to cause ongoing destruction of various organs and body parts. We don't want that. We want to identify that, put that thing into remission, and we can do that.
Since you brought up inflammation, can you outline a few effective strategies that people could incorporate to reduce inflammation?
So, well, you know this first and foremost, nutrition, right?
Mhm.
Nutrition is extremely important. You want to get rid of as much extraneous sugar in your diet as possible. You want to be going tendency toward a Mediterranean diet seems as a general diet for everybody. The data is strongest on that, but you also want to, there are autoimmune diets. There's things that you need to tailor for an individual, and so that needs to be paid attention to. Uh, Exercise is one of the best anti-inflammatories for the body, period, especially for the central nervous system. So regular exercise, including both aerobic and anaerobic exercise. So you want to be lifting weights and building muscles. Now you don't have to be building, bodybuilding. You were in that world for a while, but you do want to be doing toning and weight building exercises, because a different set of chemicals get secreted from healthy muscles that help keep you healthy. And then
Mhm.
the aerobic component of it is also crucial in order to remain healthy. So diet, exercise, sleep, kind of the foundations. Okay. I'm a big person on meditation as well. I think meditation is extremely valuable in terms of re-regulating and quieting your nervous system and all the rest of your systems. So,
Mhm.
excuse me. So those are the basis. And then some of the things we talked about, using things like low dose naltrexone, using metformin. Metformin is a diabetic drug, which we use in order to regulate blood sugar. But metformin may turn out to be one of the big breakthrough drugs in terms of longevity. So metformin down regulates the acquired immune system, and looks like it does a lot in terms of reducing inflammation in your system. So that's another way to do it. You want to also pay attention to things that repair mitochondria. And so using products such as NMN can be
Mm.
extremely valuable in terms of doing that. Uh, the so NAD is part of the mitochondrial cycle in terms of creation of energy. So you want to be able to repair that process. And NMN, which is nicotinamide mononucleotide, is extremely important part of that cycle and can be taken orally. So you want to make sure you're getting a good quality NMN. I have no financial relationship with this company, but the company that I think at the moment is putting out one of the best products is Signal. And so we use that product as for recommending for our patients. So other things that you want to be paying attention to, quercetin can be good in terms of balancing the immune system, as can vitamin B and vitamin D. Vitamin D, the norm values for vitamin D are set way too low. The norm values for vitamin D should
Mm.
be 50 to 80 nanograms per deciliter, period. And the
Mhm.
evidence is extremely strong for that. Low vitamin D levels increase your risk for infection. Low vitamin D levels increase your risk for cancer. And low vitamin D levels increase your risk for long haul COVID and increase bad outcomes in terms of getting COVID. That study was just released in the last couple of weeks. So the fact of the matter is healthy vitamin D levels are essential, and you should be aiming for 50 to 80 nanograms per deciliter. Healthy vitamin D, 20 minutes of sun exposure, arms, legs, head, and neck for every day, if at all possible. It's not quite as possible in my neck of the woods as it is in yours, but also checking your vitamin D levels. And otherwise, we will supplement with vitamin D3.
How often do you think people should get their vitamin D checked?
I think seasonally, because things change according to how much you're outside. The other thing is, if you're outside and you're wearing sunscreen, no vitamin D production. Sunscreen will shut vitamin D production. So you need to, even if you're outside all day long, but you wear an SPF 30 or 50 or whatever, yeah, you're protecting your skin, but you're also failing to produce vitamin Z, which is essential for your health. So you want to make sure you're getting that as well. So get that checked. These are things that these should be part of everybody's physicals. You should be getting vitamin D levels checked. Simple, easy.
Yeah, I think there's obviously people get scared of the whole idea of skin cancer, but then as you just said, if your vitamin D is low, you actually have increased risk of cancer.
Yeah.
And, all of that has a lot more to do with the toxins and the food and the lifestyle and everything else alongside that. I don't personally don't wear sunscreen unless I'm in the sun for a very long time. But I've had clients say that when they come in and they're eating, standard American diet, they have toxins in their bodies, et cetera. And then once they change their diet and we start to work on their health, they're like, Rachel, my skin, it looks different when I go outside. It's not burning as quickly, because you have more of a protective mechanism going on. So it's just really cool once you actually start to work on your health, and then your body responds much, much differently to the sun as well.
The other thing that'll tonify your immune system, though I hesitate to mention, is
Mhm.
ice baths.
Ah, love ice baths.
Soaking, not me so much, but screaming loudly helps in getting into them. But you want something that's about 50 degrees or a little bit less. The fact of the matter is it shifts your metabolism, so you're producing more brown fat instead of yellow fat. It clearly tonifies the immune system. Basically, we've seen studies where there's a 29% decreased absence rate from work and school in people who are taking cold showers and doing ice baths on a regular basis. So this thermal regulation that we do from one extreme to another can be very beneficial. You have to be careful, like everything else, and thoughtful in the process of doing it, because you don't want to injure yourself. But 5-10 minutes in an ice bath a day or several times a week really does a lot in terms of tonifying your immune system.
Mm-hmm. Before, when you mentioned when you were doing your intakes, you made a comment about asking people, have you been sick since childhood, right? Like those kids who always were getting illness. Like me, when I was born, I actually had pneumonia like as an infant, and then many other times in my life as well. So I had that inherently weak immune system. Is there anything different that you do for those people, or is it just, hey, you really need to double down on the vitamin D, the ice baths, the meditation, the sleep, etc.?
It depends how sick they are, right? So on you, for instance, you would have been a prime candidate for testing your IgG levels, right? And if there's a hole there, if you will, if you're not producing all the subcategories, then utilizing something like intravenous immunoglobulin can be very beneficial. So again, if you're up walking around, you're doing okay, but you've got some symptoms, we're not doing that. And on the other hand, if you're incapacitated, which a number of my patients are, most of my patients are very sick and have been sick for a long time. And so we're looking at an immune system which has gone totally rogue. So if we can take care of all the things that tripped off the immune system will frequently quiet itself back down. But if it's still hyperreactive, then we have to do more extreme measures. So intravenous immunoglobulins can be one way to do it. Plasmapheresis, where we wash the blood of the immunoglobulins, is another way to do it. Rituximab, where we literally stop the production of B cells, which is the acquired immune system, in order to stop making the ones that are doing the damage. So there are some more extreme measures that we do. And in our patients who are really sick and really struggling. Our kids who have pandas, for instance, a lot of them, their immune systems have gone so wacky doodles that we do a test in the specific parts of the immune system, right? So we're looking at the Cunningham panel, which looks for antibodies to specific areas in the brain called the limbic system. Those kids will see issues with what's called pseudo seizures, pseudo because we're not able to measure in depth deep enough to pick up where the seizure activity is with the standard EEGs, but behavioral disorders. And so what we do with these kids is we've got to clear all the infections first, clear all the toxins out of them first. And then if the immune system's still off, then IVIG or plasmapheresis may be a lifesaver for these kids. And that's the difference of them not getting all the way better and in fact, getting back to a full normal life.
Wow. How long do they stay on the intravenous immunoglobulins for?
Trick question. And it's hard, and you have to figure out. I have one kid who's been on it for almost 2 years now. On the other hand, he is fully back engaged in his life. In fact, he's going to chef school and planning to be a chef. But he couldn't have done that 2 years ago until we started the IVIG on him. And so now he's got his full life back. Other kids, we can get away with 3 to 6 months. I have one woman who within 6 months' time on the IVIG, 100% remission. Her chronic fatigue was gone, fixed, done after we had done the other stuff to her. And she has remained in remission and thriving and doing well. She has a family of 3 kids and is a poet. She's really quite lovely individual and fully active in her life again.
I wish my parents found you when I was a kid. That's all I have to say on
Ah,
that. Yeah,
thank you.
really could have helped me with my chronic symptoms that I had. Um, so I want to
We're learning, we're getting better,
yeah, it's
and
fantastic.
we're trying to educate other physicians about this.
Hmm. So important. Um, you wrote a book all about infections, right? And as that being a main part of why people are sick. Um, you've mentioned Lyme disease a little bit. What are some of these infections that are often hidden, whether common ones or not so common ones? What do you see on people's lab results?
Oh, toxoplasmosis, which you can get from your lovely little kittens. Uh,
Okay.
Mycoplasma pneumonia, which is in the air and more, but you can certainly pick it up in childhood and see it there. Strep infections, notorious, especially in the Pans Pandas crew. Um, Lyme, but Lyme is not just Lyme. Lyme is Bartonella, Babesia, Anaplasma, Ehrlichia. So there's a whole bunch of different tick-borne relapsing fevers of different types of tick-borne diseases, not inclusive of Rocky Mountain spotted fever, different tick-borne diseases that can cause all kinds of problems. And again, if you haven't, if so, one of the problems with the standard testing for Lyme disease is it looks for Borrelia burgdorferi, which is lovely, except there's about 8 subspecies of Borrelia Miyamoto, Afansi, and some others. And if you haven't tested for those, you're not going to find those. So the Lyme test comes back and says, oh, it's fine, except it missed the subspecies. So you have to get the proper testing done, and that's always been a challenge. And there's lots of controversy as to which test is one and not. Now, in the book, Why You're Still Sick, I specified the testing that we do and the things we go looking for, and the parameters that we're looking for in that, because I want to put as much information in as many people's hands. There's over 20 million people
Hmm.
struggling with these conditions out there, and inclusive of anxiety disorders and depressive disorders, which are non-responsive to treatment because they miss the diagnosis. And so what we want to do is put as much information in as many people's hands as possible so they can go out, talk to their doctors, find doctors who in fact will work with them and be able to get this testing done. So that's all laid out very specifically. So this is my second book. My first book, Total Recovery, was about talking about the immune issue, and especially the innate immune system in terms of depression and chronic pain issues. This is a how-to book. This is, here's all the information. Here's what we do day to day in the practice. Here's what you can be talking about with your physician. Here's what you can do for yourself. And so that was the purpose of writing this book. And this is only a couple of me, and there's about 20 million out there who are in need of care, and we have to do a better job of both educating patients and helping them educate their physicians about this.
Hmm. Um, can you share what the test is, or
Well, the
is it?
testing we typically use is IGeneX. Vibrant Labs is another one that I think are two of the better testing out there at this point in time. And so using those two labs for the most part is how we go about making the diagnosis and find them consistently reliable. The testing is getting better year after year. There's some immunoblot testing, which is far more sensitive than the other testing was. And so looking at that. Other bugs, by the way, is Epstein-Barr, which gets overlooked a lot. And
Mhm.
Epstein-Barr mono, okay? Mono, everybody's had mono, except that a percentage of people end up with recurrence of mono. And then how do you diagnose recurrence of mono? That's controversial also. But basically, there are 3 IgM categories there's IgM when you have acute mono, but there's 3 IgG categories, 2 of which should stay positive after you've had mono because that's just long-term immunity. But the early antigen should not. So the early
Mhm.
antigen, and again, if you don't test for this, because normally what they test for is 2 of the IgGs, but not the third, which is the early antigen. If the early antigen and the other 2 IgMs are positive, so all 3 IgMs are positive, I regard that as persistence mono.
Mhm.
And so you need to go looking into treatment of that as well. And there are antiviral agents that you can use. There are monolaurin as a supplement derived from coconut, which can be useful. There are some other supplements that can be useful in terms of treating this, but that's a particularly tough problem to treat, but it can be done. So, and Epstein-Barr has been associated with development of multiple sclerosis. So these are not benign viruses. These are viruses which can have devastating impacts on people long term. And so we need to do everything we can in order to address them. Long haul COVID, as I said, the blessing in disguise, because now the research is getting its due in terms of the funding we need in order to be able to do this. The other thing I wanted to mention to your listeners is a conference which I created a foundation called the Foundation for Total Recovery. We, along with Georgetown, sponsor a yearly conference. This will be our third. The purpose is to educate physicians in particular, but everybody. This is New Developments in Understanding Chronic Illness Conference. This conference will be November 8, 9, 10. It's both in person and virtual. It's in person for physicians, and so we have some of the top speakers in the country, actually in the world, who will be presenting. Dr. Nath from NIH will be talking about long haul COVID and MECSF. But we have Maureen Hansen from Johns Hopkins is going to be presenting on imaging, development of imaging techniques. And some of the key people on nutrition. Kyle Landry will be talking about the impacts of the immune system on the impact of the gut on the autoimmune system and how to address it. And we're going to be looking at some really cutting edge therapies by Dr. Gustavo Moviglia out of Wake Forest, looking at stem cells and for treatment of immune disorders. So it's a very exciting conference. We've got some really superb people from the major institutions around the country speaking. So it's an opportunity for your listeners. They can attend virtually and be able to hear the latest, greatest in terms of the research. And for physicians and researchers, we want you there in person because the magic happens in the room when we have a chance to meet and talk with each other.
Mm-hmm. Yes, I have the link for that. So they could just go to that link and click register, I'm assuming, and get on there. Awesome.
Perfect. Yep, registration's open. So absolutely, thank you.
Okay, yeah, of course. I would love to just maybe wrap up a little bit with maybe a little bit of the Lyme conversation. So what are some critical steps to healing post-treatment Lyme syndrome that people should take?
So I think, it's controversial and it's an important and difficult question that needs to be addressed. So one of the things is you need to be clear on what the problem is, right? So part of the problem in post-treatment Lyme syndrome may be persistence of the Lyme itself, or Borrelia or one of its subcategories, subfamily members. In which case, then you've got to eradicate it. I just read a study this morning out of France, looking at neurologic problems with Lyme disease, where they literally had to go through 3 courses of IV antibiotics in order to be able to successfully reverse the disease. And it took them, they treated, backed off, treated, backed off. So it's an evolving concept in terms of how we do it. Using Dapsone is another for persister bugs. There's another number of things you have to do. You have to know what you're doing. You need to be an Lyme literate physician in order to be able to treat this stuff. The second thing that you can do is make sure that you didn't miss a bug. So did you miss Bartonella? Did you miss Anaplasma or Ehrlichia or Babesia? Babesia is probably the most common co-infection that we see in bugs, and Bartonella is also on that list along with Anaplasma and Ehrlichia. So we want to tick-borne relapsing fever. So we want to make sure that we've looked for and eradicated the persister bugs that we didn't treat the first time, because you have to treat those other bugs differently than you treat straight Lyme. Then comes the issue of what else did you miss? Did you miss mold toxicity? Did you miss heavy metal toxicity? Did you miss a gut that's really in distress that needs to be treated? And then what's the immune system look like? So what do we have to do in quieting down both the innate and the acquired immune system? So the post-treatment Lyme syndrome is a big, complicated question that requires a lot of expertise and careful thought in terms of taking it apart and understanding all of the pieces of it and then addressing it accordingly. So we go everywhere from, it turns out, wait a minute, your post-treatment Lyme syndrome wasn't you had Lyme, but you had mold. And we take care of the mold toxins and you get better. Not usually the case, but frequently it picks up a piece of it. The other piece of it that we see his Bartonella was missed as an infection. And then we go, okay, we've cleared all that, but now we have to quiet the immune system. And now we're back to treatments such as IVIG and plasmapheresis and those. So there's a whole range of things that need to be done. It's a big, complex problem, but it's a problem that can be solved. And it's a problem that I really encourage your listeners, if they're struggling with this stuff, find a Lyme literate physician. Okay, iLabs is the organization, and stick with it because solutions can be had.
Mm-hmm. Well, this was such an amazing conversation. I know we're coming to an end here. Are you open to doing a 5-question speed round?
Absolutely. Go ahead.
Okay. What is one supplement that you could not live without?
The one supplement I could not live without is probably NMN.
Nice. You said the one you like is called Signal or Cigna?
Signal.
Signal.
As in sending a signal.
Okay. Awesome. What's your favorite thing to do for stress reduction?
Exercise and meditation. So I gave you 2 things.
Okay. If you could eat one meal for the rest of your life, what would it be?
Oh, trick question. You want a rapid answer to that? I don't think it's going to eat one meal for the rest of your life because you'll eventually develop antigens to it. But I would something balanced out with fruit and vegetables and protein. So, but I particularly am partial to lamb, and I love all fruits and all vegetables. So,
okay, that's a great answer.
So not a direct answer to your question, but what can I tell you?
It's a really good point
I like
about
variety.
It's a really good point about becoming having a response to eating that same food every day as to why it's important to have variety in your diet. If you could travel anywhere in the world right now, where would it be?
Japan.
Japan.
Yeah, we've been thinking about Japan a lot, and it's definitely on the list. It's a beautiful country. It's a very different culture. There's some meditative practices and temples I want to go visit, and so yeah, Japan would be next on my list.
Mm-hmm. I hear nothing but good things about Japan, and also that it's like one of the safest countries to go to as well. Yeah.
Yeah, a dear friend just came back, and the pictures she brought back are just astonishing. There are some magnificent, beautiful places in Japan. So on the list.
If you could leave the listeners with one tip that they could implement this week to help them live a healthier, happier life, what would that be?
Yeah, proper sleep. Sleep, I think, is kind of the foundational basis of everything. If you're not sleeping properly, everything else goes to hell in a handbasket. So work with whatever needs to be done in order to get your sleep restored first. Build on that in terms of exercise and nutrition, but sleep.
Totally agree with that one. Well, any last words, or do you want to share where people can find you?
We're on kaplanclinic.com, and I hope you'll buy the book, because the book was written in order to help you and figure out how to help yourself. I think the main message I want to leave is with hope. There are so many people out there who are despairing. I mentioned a friend of mine's book to you early on before we went on the air, which is Women of a Mysterious Illness. I think it's an extremely important book by Sarah Remy, and it's one that helps resonate and understand the pitfalls of what's going on in modern medicine and how important it is to be a self-advocate. And don't let people write you off. You deserve to be, and you should be seen, heard, and respected. So if you're not that, fire your physician and move on.
Yes, good tips. We'll put all of those links in the show notes. And thank you again for being on the show, Dr. Kaplan. This was a great conversation.
Rachel, I'm delighted to be here. Thank you for all the work you're doing with these podcasts, because they're extremely important to get the information out. So thank you.
Thank you. Thank you so much for watching this video. Don't forget to like this video and comment, letting me know what you enjoyed and what you want to see more of. Also, please subscribe and hit the notification bell so that you get alerts when new content is coming out and you don't miss any videos. And just a quick reminder that this information is for educational and entertainment purposes only. It is not intended to diagnose, treat, or cure any illness or medical condition. Please consult with a qualified healthcare professional before making any changes to your diet, exercise routine, supplements, or medical treatment. If you're looking for a functional medicine practitioner, please reach out to me. And thank you again for watching, and keep striving to become your healthiest, happiest self.